Hi all, welcome to yet another informative video of NS Pharma. In today's video, we are going to see 10 important multiple choice questions. Try to write the correct answer for each question. These questions are previously asked questions of various pharmacist competitive exams. In the question itself, I mentioned the name and year of the question paper. Each correct answer carries 1 mark. Try to do all 10 questions and don't forget to comment your score. Let's begin. The first question is, which one of the following drug has positive inotropic and negative chronotropic action? Which one of the following drug has positive inotropic and negative chronotropic action? Options are option A dopamine, option B epinephrine, option C digoxin, and option D isoprenaline. Okay, now it's time for your answer. 10-second time is there. You can opt your answer. The correct answer for this question is digoxin. Digoxin has got positive inotropic and negative chronotropic action. So what is inotropic and what is chronotropic action? Inotropic means it's related to the force of contraction of the heart, inotropic effect. Then chronotropic effect is related to the heart rate. Okay, so positive inotropic means it will increase the force of contraction of the heart, and negative chronotropic means it will reduce or it will slows the heart rate. That is the negative chronotropic action. Okay, here digoxin has got positive inotropic and negative chronotropic action. What about the dopamine? Dopamine has got, here you can see, dopamine has got positive chronotropic and positive inotropic. Both are positive. That means it will increase the force of contraction as well as it will increase the heart rate. Okay, now the second one is epinephrine. Epinephrine has also got the same, that is positive inotropic and positive chronotropic action. About the digoxin we studied, the answer was digoxin. It has got positive inotropic and negative chronotropic effect. Here the last one, isoprenaline, it has also got positive chronotropic and positive inotropic action. Hope you understood this question. Digoxin has got positive inotropic and negative chronotropic action. Digoxin is a cardiac glycoside. Now we are moving to the next question, question number 2. An example for indole alkaloid is, an example for indole alkaloid. This question was there in the Kerala Drug Analyst question paper on 2020. Options are quinine, option B atropine, option C ephedrine, and the last option, that is strychnine. Which one of the following has the indole alkaloid? It's your time to write the answer. Hope you got the answer. The correct answer for this question is strychnine. Option D, strychnine. That is from Nux vomica. Okay, it has got, Nux vomica has got 2 indole alkaloid mainly, that is strychnine and brucine. It is used as a dog poison. Okay, that is also one important point regarding this strychnine. Now we will see different alkaloids. Alkaloids are classified into different types based on the chemical structure. That is, first one is indole alkaloid, then isoquinoline alkaloid, then quinoline alkaloid, then proto or amino alkaloid, then propane alkaloid, then purine alkaloid, pyrimidine alkaloid, steroidal alkaloid. These are the different type of alkaloids. Here the question was regarding indole alkaloid. Example of drugs coming under indole alkaloids are Vinga, Ergot, this one Nux vomica, then Rauwolfia. These are the important example for indole alkaloid. Vinga contain vincristine and vinblastine as an alkaloid. Then Rauwolfia, reserpine, ergotamine and ergometrin, and Nux vomica, strychnine and brucine. Next one is isoquinoline alkaloids. The drugs coming under isoquinoline alkaloids are ipecac and opium. Okay, ipecac and opium. Ipecac contain memetin, then opium, that is papaverine. Now next one is quinolin alkaloid, important drug, Syngona, quinine and quinidine, anti-malarial drug. Then it's coming tropane alkaloid, in the word itself, tropane alkaloid. So atropa belladonna, tropane, atropa belladonna, that is belladonna, then datura, then hyoscyamus, all contain atropine and hyoscyamin as the chemical constituent. Then purine alkaloid, tea and coffee is a purine alkaloid. Example for pseudo alkaloid is caffeine. Okay, example for pseudo alkaloid is caffeine. Now amino or protoalkaloid. Why it is called amino or protoalkaloid? Because it is derived from the amino acid, but the nitrogen atom is not there in the heterocyclic ring. That's why it is called protoalkaloid. Alkaloids are classified: true alkaloids, then protoalkaloid, then pseudoalkaloid. True alkaloid means they have nitrogen on the heterocyclic ring and it is derived from amino acid. Protoalkaloid or aminoalkaloid, they are derived from amino acid. That's why it has got the name of aminoalkaloid. So it is derived from amino acid, but it is lack of nitrogen in the heterocyclic ring. So that is the protoalkaloid. What about pseudoalkaloid? Pseudoalkaloid contain nitrogen in the heterocyclic ring, but it is not derived from the amino acid. Example of pseudoalkaloid is caffeine. Example for protoalkaloid is ephedrine. Is one of the good example. So we studied tropane alkaloid right now. Then amino alkaloid is also we covered. Now purine alkaloid is tea and coffee. That's one also we covered. And this one, in the case of caffeine, we have to study the difference between the theobromine, caffeine and theophylline. Okay, the chemical name of theobromine, caffeine and theophylline. Now next one is steroidal alkaloid. Steroidal alkaloid examples are ashwagandha, that is Indian ginseng, ashwagandha, veratrum, kurchi, all are coming under steroidal alkaloid. Why it is called steroidal alkaloid? Because steroidal alkaloid contain steroidal moiety or steroidal ring in the chemical structure. That's why it has got steroidal alkaloid name. Now we are moving to the next question, question number 3. In a prescription, post-cibos means. In a prescription, post-cibos mean. What do you mean by the Latin term post-cibos? Options are before food, option B after food, option C as directed, option D occasionally. So what is the correct answer? Write it on your answer. This is one of the simple question. The correct answer is option B, that is after food. Post means after, cibos means food. Okay, post means after, then cibos means food. So what is before food? What we will call in Latin term for the before food? For the before food, here before food we will call it anti-cibos. Okay, anti-cibos. That is the before food. Anti means before, cibos means food. For the between meals or between the food, that is called intercibos. Intercibos. Okay, intercibos means between meal or between the food. Now we are moving to the next question, question number 4. ELISA is based on. ELISA is based on. This is GPAT 2019 question. ELISA is based upon. What is the working principle of ELISA? Options are antigen protein interaction, option B antibody protein interaction, option C antigen antibody interaction, option D lecithin antibody interaction. Now you can write it on your answer. 10-second time is there. Hope you got the answer. The correct answer for this question is option C, that is antigen antibody interaction. ELISA is based upon antigen antibody interaction. What is the full form of ELISA? Enzyme linked immunosorbent assay. Okay, enzyme linked immunosorbent assay, that is ELISA. Now we are moving to the next question, question number 5. As per the sieving method, the powder is passed through a set of sieves which are arranged in. As per the sieving method, the powder is passed through a set of sieves which are arranged in the dash order. Options are random order, ascending order, descending order, any place. Now you can write it on your answer. The correct answer for this question is option C, that is descending order. descending order. That means largest sieve size will be in the top of the set of sieve, okay, and in the bottom the smallest sized one. Now we are moving to the next question, question number 6. Gold in rheumatoid arthritis. Gold in rheumatoid arthritis. We know gold is one of the DMRD, that is disease modifying anti-rheumatoid drug for the rheumatoid arthritis. Options are: can cause a regression of degenerative lesions. Option B, can reduce the concentration of rheumatoid factor, does not halt the progress of the disease. Option D is employed as first line therapy. Now you can write it on your answer. The correct answer for this question is option B, that is can reduce the concentration of rheumatoid factors. Okay, gold is not a first line therapy against rheumatoid arthritis. It can halt, okay, it can pause the progress of the disease, but in the option it was does not halt, but gold can halt the progress. The correct answer for this question is can reduce the concentration of rheumatoid factors. Okay, so I think you know the drugs against rheumatoid arthritis. Anyway, I will give you a small idea regarding these anti-rheumatoid drugs. Anti-rheumatoid drugs are classified mainly 3 types. Okay, first one is DMARDs, that is disease modifying anti-rheumatoid drugs. The second one is biological response modifiers or BRMS. Okay, biological response modifiers. Then third one, that is adjuvant drug. Okay, these are the main 3 categories. In each category we will see. The first one is DMARDs, that is disease modifying anti-rheumatoid drugs. The drugs coming under this class are: first one is immunosuppressants like methotrexate, azathioprine. Okay, methotrexate and azathioprine are coming under immunosuppressant. The second drug which is coming under DMARD is sulfasalazine, then chloroquine, then leflunomide, then this one gold, then D-penicillamine. These are the drugs which is coming under DMARDs. Now biological response modifiers. Okay, example for this one is anakinra, that is interleukin 1 antagonist, then TNF alpha inhibitors like infliximab, etanercept. Okay, these are the example for TNF alpha inhibitor which is coming under biological response modifiers. If you don't know these things, you can write it on your notebook or you can refer the pharmacology textbook. And in the case of adjuvant therapy, the drug coming are corticosteroids. Example is prednisolone. Okay, now we are moving to the next question, question number 7. Synonym of chlorinated lime is. What is the synonym of chlorinated lime? That was the question for Kerala-PHARMACIST grade 2 on 2015. Options are sodium hypochlorite, option B calcium chloride, option C chlorhexinol, option D bleaching powder. The question was synonym of chlorinated lime. You can opt your answer. The correct answer for this question, that is the synonym of chlorinated lime, is bleaching powder. Bleaching powder. Bleaching powder is also known as calcium hypochlorite. You see the first option, that is sodium hypochlorite, not sodium hypochlorite. Bleaching powder is calcium hypochlorite because it is prepared by treating chlorine with slaked lime or calcium hydroxide. So you got another synonym, that is calcium hydroxide is slaked lime. Slaked lime is calcium hydroxide. Then another term regarding this one, calcium, is quicklime. Quicklime is calcium oxide, CaO. Okay, that one slaked lime is CaOH twice. Hope you got this one. So calcium hypochlorite is bleaching powder, calcium hydroxide is slaked lime, then quicklime is calcium oxide. Now we are moving to the next question, question number 8. Pentoses and hexoses can be distinguished by one of the following tests. Pentoses and hexoses can be distinguished by one of the following tests. Options are Bial's test, option B Morris test, option C Selivanov's test, option D Benzidin test. You can write your answer. Each correct answer carry 1 mark. Okay, once the exam is over, you have to comment your total mark. Okay, The correct answer for this question is option A, Bial's test. Pentoses and hexoses can be distinguished by Bial's test. So what about the Morris test? Before going to the Morris test, we should know what is pentose and what is hexose. Pentoses are the carbohydrate which has got 5 carbon. Okay, hexoses are the carbohydrate molecule which has got 6 carbon. Okay, penta means 5, hexa means 6. Pentoses are carbohydrate which has got 5 carbon, hexoses are carbohydrate which has got 6 carbon. Okay, so pentoses and hexoses can be distinguished based on the test of Bial's test. So what is Morris test? Morris test is used to check the presence of carbohydrate. Okay, Morris test is used to check the presence of carbohydrate, total carbohydrate. Okay, now the second one is Selivanov's test. What is the Selivanov's test? Selivanov's test can be used to distinguish between aldoses and ketoses. So what is aldose and what is ketose? Aldose and ketose are monosaccharides which has got aldehyde group and which has got ketone group respectively. That means aldose contain aldehyde group and ketose contain which group? Ketone group. Okay, monosaccharide which has got aldehyde group is called aldoses. Monosaccharide which has got ketone group is called ketoses. So what are the examples of aldoses and ketoses? Aldoses example are, that means which has got aldehyde group, are glucose, ribose. The next one is ketoses. Example of ketoses are fructose and ribulose. Many other examples are also there. These are the some important examples. That's why I mentioned that one only. So what are the example for aldoses and ketoses that you know right now? So what is the example for 5 carbon and 6 carbon carbohydrate? 5 carbon carbohydrate example is ribose and deoxyribose. Ribose is there in the RNA and deoxyribose is there in the DNA. Okay, so what is the example for 6 carbon atom? 6 carbon carbohydrate, that is glucose and fructose. Okay, now we are moving to the next option, that is benzene test. What is the benzene test? Benzene test is used to identify or used to check the presence of blood. Benzene test is used to check the presence of blood. Now we are moving to the next question, question number 9. Blood and blood products are governed by. Blood and blood products are governed by. This was the question for drug inspector in 2015 for the UPSC. Options are Schedule B, Schedule C and Schedule C1, Schedule G, Option D, Schedule W. Okay, now you can write your answer. According to the Drug and Cosmetic Act, blood and blood products are governed by which schedule? The correct answer is option B, that is Schedule C and Schedule C1. Okay, what about the Schedule B? What is Schedule B? Schedule B related to rate of fees of test or analysis. Schedule B is the rate of fees of test and analysis. Next one is Schedule G. Schedule G is the list of substances or drug which should be carried out in the presence of medical supervision. Okay, drugs or substance which is to be used under medical supervision, that is called Schedule G. What is Schedule W? Schedule W is the list of drug which is marketed under the generic name. Okay, the list of drugs marketed under generic names are there in the Schedule W. Now we are moving to the last question of this video, that is question number 10. Phytomenadione is. What is phytomenadione? There was a question for Kerala Pharmacist in 2019. Options are option A niacin, option B vitamin K, option C pyridoxine, option D lipoic acid. So phytomenadione is. You can write your answer. The correct answer for this question is option B, that is vitamin K. Vitamin K is the phytomenadione. Okay, what about the niacin? Niacin, I think you know this one. This is vitamin B3. Okay, vitamin B3 is also known as niacin. What about the pyridoxine? That is vitamin, come on, vitamin B6. Okay, that is vitamin B6, pyridoxine. What about cyanocobalamin? It is vitamin B12. Thank you very much for watching this video. Hope you enjoyed and benefited. Here is the bonus question for you. What is the use of ergometrin? We studied ergot is coming under the class indole alkaloids. The alkaloids present in the ergot are ergotamine and ergometrin. The question is, what is the use of ergometrin? Okay? Write down your answer in the comment section and don't forget to comment your score also. Thank you.